Hello, everyone, and welcome to today's event. I am Jessica Mason Pieklo, the Senior Vice President and Executive Editor of Rewire News Group. And today we are here talking about the chaos that is transpiring thanks to the courts allowing Texas's unprecedented near total abortion ban to take effect. SB 8 would ban abortion as soon as cardiac activity in a pregnancy is detected. It deputizes third parties to act as abortion enforcers in the law and creates a whole new category of enforcement around aiding and abetting an abortion. Let me just tell you, folks, if you haven't already figured it out yet, this law is a mess. And by letting it take effect, it's causing real damage in real time. And we are going to get into that, not just in Texas, but beyond. But first, a couple of housekeeping items that I have to go through. In this panel, we encourage questions. So if you have a question for our panelists or for me, please use the Q&A tab at the bottom of your screen to submit it. I'll be monitoring that Q&A tab, and I will do my best to get to as many questions as I can. Please keep them coming. If I don't get to your questions and you'd still like an answer after the event, please email it to events@rewirenewsgroup.com. That's events@rewirenewsgroup.com, and we'll try to get an answer to you as soon as we can. And you should use that same email address again, events@rewirenewsgroup.com. If for any reason you needed any assistance at all during this event, I am a lawyer and a journalist. I have no tech background, so I cannot help you if something goes awry. Please email that. We will do our best to get you logged back in. We have a staffer on standby to assist if anything tech-wise should go sideways. So I'm here to talk and not manage the tech. I'm glad to have support for all of that. Let's get to the event at hand and meet our panelists. I am thrilled and deeply honored to introduce Dr. Ghazaleh Moayedi. She's a board certified OB-GYN and complex family planning specialist who has devoted her career to serving the full spectrum sexual and reproductive health needs of people in Texas. Dr. Moayedi is the founder and chief medical officer of Pegasus Health Justice Center, a community health resource that creates holistic community wellness through justice-centered, patient-oriented healthcare and advocacy. Dr. Moayedi is also a founding member of, I will mess up this acronym. I'm going to do my best to get it right. CERCLA-FP, the Centering Equity, Race, and Cultural Literacy in Family Planning. It's a collective that works to name, disrupt, and dismantle the systems of oppression in family planning care. Snaps to that. That's so important. And in addition to this clinical work, Dr. Moayedi conducts research aimed at improving access to abortion care and improving abortion experiences for patients. Again, snaps to all of that. She is a fierce advocate for her community and is involved in local, state, and national reproductive health rights and justice advocacy, has been all over the media and your internets talking about SB 8, and we are just thrilled to have her. In addition to her work there, she's also on the board of directors for Texas Equality Access Fund and Physicians for Reproductive Health. Do you ever sleep? I have no idea, Dr. Moayedi. Thank you for joining us. We also have Aimee Arrambide, the Executive Director of Avow, Texas. Avow is an unapologetically pro-abortion nonprofit. Let's say it again, unapologetically pro-abortion. And they are working for a better Texas where every person is trusted, thriving, and free to pursue the life they want. Aimee has devoted her life's work to fighting for Texans' reproductive autonomy, which means she's working for everyone's autonomy because, as we'll discuss in this panel, what happens in Texas never stays in Texas. We also have Odile Schalit, who is the executive director of the Brigid Alliance. Odile is a leading national expert on travel for abortion care and regularly consults and collaborates with national and local organizations about this increasingly recognized need. Prior to joining the Brigid Alliance, Odile was a social worker at Planned Parenthood, New York City, and has worked professionally as a birth and abortion doula from 2009 to 2013. She's been a guest lecturer on topics of interpersonal violence in a reproductive health setting and speaks frequently on the landscape of and barriers to access to abortion in the United States. We also have someone from Trust Women Wichita, Ashley Brink, who's going to join us when she has the opportunity. Things are a little busy in the clinic land right now, and so they are joining as they can. When they come in, we will do the introduction there, but I definitely did not want to hold things up. Be very respectful for our panelists and their time. So thank you all for making time for this very important conversation, and in particular, carving time out of the work that you are doing, providing care to Texans in Texas and outside of the state. So Dr. Moayedi, I'd like to start the conversation with you. As a provider, you have been, well, you know what? I don't even know what the last month has been like. I can't even fathom a guess. So can you just paint the landscape for us for a little bit? What is it like trying to just do your job when the courts are ping-ponging laws and patients across the country?
I mean, it sucks. It's next to impossible. It sucks. It sucks a lot. This isn't the first time that providers in Texas have had to deal with this. It's not the second time. Maybe it's the third or fourth. It's incredibly frustrating. It's frustrating as a physician and an OB-GYN, knowing the difference in how I deliver miscarriage care versus abortion care, even though I'm actually doing the same thing. I'm counseling around the same thing, doing the same procedures, I'm using the same medications, but that human rights are different for people depending on where I'm practicing and what exactly an ultrasound says, which, it's not technically what I went to medical school for, but it is also what it should be in the forefront of every physician or healthcare provider's mind. The context in which we deliver care really varies.
Can you speak a little bit more about this experience in miscarriage management right now, and how that's being impacted in part as a result of SB 8 taking effect? Because I know as we have these conversations in abortion and reproductive justice spaces, I think the tendency is to talk quickly about the impact in pregnancy management broadly. But the reality is abortion is part of comprehensive reproductive and pregnancy care. And therefore, any abortion ban is going to impact pregnancy care broadly, right?
Exactly. Every abortion ban is unjust. Every abortion ban is dangerous to the health of pregnant people. And so, it's not just SB 8 that needs to be overturned, but every other ban that we see across this country. Abortion is not separate from birth. And that's something that I really try and educate people around. Like, pregnancy care is pregnancy care, and abortion and birth are on a continuum. They're not separate ways of thinking about care. They're not separate ways of approaching health and wellness. You can't have healthy birth without access to abortion care too.
Aimee, you and your organization and advocates in Texas had been raising the alarm bells around SB 8 well before it was allowed to take effect by the Supreme Court. And as Dr. Moayedi has indicated, it's not like SB 8 is the only abortion ban that is on the books in Texas. And I sort of teased your intro question in the beginning by suggesting that what happens in Texas doesn't stay in Texas. But as somebody who has been fighting not just reproductive justice battles in Texas for as long as you have, but broadly for progressive priorities in the state, what is it about anti-choice activism and Texas that has created such a breeding ground for these kind of bills that then get, sort of laundered nationally? Help those of us who don't live in Texas understand the political climate a little bit, if you can.
Sure. I mean, I think there's a couple of things that lend really well to this. One is that Texas is an incredibly gerrymandered state. We have a low voter turnout, but also a really high voter suppression, laws and policies put in place. We are also really well poised for the anti-abortion people to be right in the Fifth Circuit district, which means that anything that gets struck down by a federal court will eventually end up in the Fifth Circuit and will be reversed and put back into place, right? And so I think that's a number of reasons that contribute to that. In addition to that, there's so much stigma surrounding abortion care in general. Texas is a place that overwhelmingly supports abortion care and has since Roe v. Wade. I mean, depending upon how the questions are written, anywhere between like 52 and 63% of Texans support abortion care. And generally that is because like the difference is because of the way the question is worded and not because people don't necessarily support it. They do overwhelmingly. The problem is that we don't have a lot of avenues in which to like advocate for it, especially when we're not represented by our legislative makeup and body, especially when, you know, we've got governors who are making things more difficult to do anything. So like that's one or many reasons that contribute to that. Then I think you've got a culture that doesn't want to talk about it or challenge it. And even the people on our side in office don't even want to talk about the word abortion or abortion care, won't say the word abortion. And these are the progressive people in office. So like that also causes a big disconnect between what people want and what's happening at the legislature. And people negotiate away abortion all the time in terms of progressive issues, and they try to pit us against each other. So I don't think it's very surprising that this is happening. Not only that, but we're a state that has 254 counties, right? A lot of them are rural, and that's why something I don't know if you'll bring up later, but a lot of these municipal bans that are like everywhere across Texas and are now spreading to Ohio and other states have been implemented because they don't really affect a lot of policy change. A lot of those like rural areas don't have abortion clinics, but they do like scream out this value that is not representative of Texas. And, you know, they spread anti-abortion rhetoric and allow it to be pervasive through society. So I think there's several reasons that contribute to this, and all of those are among them. And it's just more complicated than Texas is conservative and we don't support abortion access, because that's absolutely not true.
I am so glad you brought up the municipal ordinances because, and I'm just going to jump into it right now because this is absolutely something that we are seeing start to take effect and spread. So SB 8 didn't just appear out of nowhere, right? There were these local campaigns to create sanctuary cities for the unborn. And as you mentioned, these campaigns existed in places that oftentimes didn't even have an abortion provider. So what is that all about? Can you add a little context for that? Because as an outsider, I see those city council meetings, you know, I see local advocates covering them, and then we have a state ban. So is part of the playbook in gerrymandered states doing something like municipal ordinances to create an appearance of support for something like this and then shop it statewide? Is that some of the strategy that's going on?
Absolutely. I think that's so true, because when people have notice of the city ordinances and are able to wrangle supporters, like they get defeated, like what happened in the Rio Grande Valley. Like people knew in advance, they you know, garnered support, educated people, told people what was happening and told them where to show up. In other municipalities, it just kind of shows up on the agenda and it passes because not a lot of people are engaged necessarily in the local, you know, city, governance. And so it's like really hard, especially for advocates who can't be in 254 counties at once, to be able to combat them. And then you've got people that just don't even want to talk about abortion, so they don't necessarily feel comfortable or don't have the tools to talk about it in their communities and dispute that. It's one of the reasons why part of Avow's theory of change is our Let's Talk About Abortion training, because we just really feel like the place to start is talking about abortion unapologetically in our communities with language that resonates with people that we love and care about, so that if just having this conversation out loud and about our support, that can like permeate into like, you know, civil action. But we're just not there yet.
Yeah, and I think it's important for people outside of Texas to understand that these municipality movements, they're not individual communities that are coming together and saying like, we need to address this. It is actually an activist going around and doing this, right? Well-funded. And that also is the right lawyer representing Texas Right to Life in our lawsuits right now. So this is our state government and local governments really acquiescing to who? not their communities, for sure.
Right. And so like we saw in Mississippi in what would become that state's 15-week ban, and in the Dobbs case that's now before the Supreme Court that will be argued in December, outside advocates came in and effectively shopped a piece of model legislation to create a pipeline. And so Texas seems to be a really good location for this to happen. And so the idea that now we're starting to see that this campaign take place in places like Ohio, I think is something that should be on everybody's alarm bells, because this is not just patients needing to travel to access care. This is advocates outsourcing their campaigns to other gerrymandered states. So Odile, I want to talk to you for a second, since your organization helps facilitate travel around care. And this is a part of the conversation that has come up a lot with the courts allowing SB 8 to take effect, is the fact that patients in Texas have needed to travel out of state to access care. Providers in Texas have needed to travel outside of the state to perform care, to do their jobs. However, SB 8 is not the reason why people have needed to travel for abortion care. Abortion restrictions existed before SB 8 and necessitated travel as a result of it. And so I'm wondering if you can speak to that a little bit, because one of the things that concerns me every time a new shiny abortion ban comes up is that national attention focuses around it, and it feels like a fresh new thing. And then the courts will get distracted and the people's attention goes with it. And what happens is that when the people's attention goes, folks still need care. And I worry that we do harm when we coalesce around a real big moment like this, and then the media starts to dissipate a little bit. So I'm hoping you can talk about just travel for care and what SB 8 has done to exacerbate that, and what that's looking like moving forward should more states take up SB 8 like bills.
Sure. So for context, Brigid is a nationwide practical support organization. That's what we refer to as organizations that provide the wraparound services to abortion access. And we provide our services to folks who need to travel for abortion care, especially later in pregnancy. Our services, like our peers that also provide practical support, range from covering transportation to housing to meal support, childcare reimbursements, any of the logistical and financial things that surround how someone is able to safely leave their home, be away from home for some days, and then come back. Yeah. And what's interesting isn't really the word. What's important about this moment and what's happening with SB 8 is that what we have been experiencing and doing with our clients for the last several years who've been traveling for abortions later in pregnancy, which is long distance travel, averaging at about 1,000 miles per client, at about $1,000 per itinerary, as we refer to it. Now we're seeing that happen with folks at an early gestation, which means that the long-term implications of this law and others like it are that travel becomes the norm of abortion access. And so, when we're thinking about what it means when a new ban or restriction comes into place, or when there's a natural disaster for that matter, or a pandemic, as we very recently experienced, or economic crisis, there is the immediate ripple effect of that. More people needing care, more people needing funding to cover the cost of their procedures, more folks needing support with their travel. We're also looking at a lot of folks unable to get their care, young people who don't have the autonomy to be able to get out of their homes, folks whose documentation may or may not allow them to be able to travel out of the areas that they live in for fear of being deported, folks who are facing interpersonal violence in their relationships and reproductive coercion, not knowing that they have the ability to travel out of that state, let alone how they'd be able to do that. And so there are as many folks as they're, trying to access care as there are people who are not trying to access care and are delayed in their access, may attempt other means of being able to have an abortion, or may have to wait until such a point as they need an abortion much later in pregnancy, and adding, more stress and stigma to the experience. And so I think, we have really been experiencing those patterns over the last several years. We've seen these surges happen. We've seen where our strengths are as a program and in collaboration with other organizations, with abortion providers, with volunteer groups that exist on, county or state or city levels, with abortion funds. But the thing that I think this moment really pulls upon is the fact that those of us who have existed as a bridge in this gap between a person and their care have long existed quite unseen.
Yeah.
And in some respects, that has actually been useful and necessary and may continue in some vein, because that discretion can be very helpful for certain communities. But in other respects, we really need for abortion funds and practical support organizations to be seen as the strong, client-centered, and necessary part of how abortions happen. And I think if we are looking at more SB8s, then we need more organizations like ours, like Fund Texas Choice, like the T Fund, West Fund, Afia Center, Lilith, Cason, Bridge Collective, all these extraordinary Texas-based organizations. We are going to need a lot of support in order to do that, and in order to also staff up to be able to continue doing that work.
So SB8 before SB8, we were already talking about regional points of access around abortion care. And I just want to open this question up to all of the panelists here. How do each of you see SB8, the longer it stays on the books, and God forbid, more copycat bills allowed to take effect? How do you see the conversation around regional points of access changing? And what does that mean, practically speaking, for abortion care in this country and for patients and providers most specifically? Dr. Moayedi, I'll start with you.
Maybe don't start with me on that one.
I'm so sorry.
I have like a deep pain in my heart around discussions on regional points of care. Like, I understand the desperate need for regional planning. And also, like, if our solution is that's not the solution I want.
Agreed.
Like, we need to dismantle the system that creates this need. And like, it's easy to say now, right? But it should have never been okay for there to be a waiting period. It should have never been okay to have a forced ultrasound. None of these things should have ever been okay. And I'm just waiting desperately for when we're all going to just say, none of this is okay. And we're not going to continue rearranging the furniture on the Titanic. Like, it's over. What's the new solution? I don't want this one.
Yeah, I want to emphasize what Dr. Moayedi said too, because I think that one of the things that got us in this position is we were okay with the right to abortion and we never really addressed the fact that access was such an issue for so many marginalized communities. And then due to resilience and innovation, like, all of these organizations popped up in order to like mitigate the harm restrictions did. And we made it so that some privileged people and people that knew about abortion funds could access the care they needed. But that, I don't know, like, I have the same worry, like, and I am in all those regional planning meetings to make sure that we can facilitate access if this stays, longer. But I also think that, like, we do ourselves a little bit of a disservice when we are so good at mitigating the harm by being resilient and innovative, because I mean, we're here right now. And I think if we had just addressed the fact that abortion as a right and legality only and not accessible was a problem 48 years ago, we'd be in a different place. And obviously, hindsight is 2020 and so forth, but I do not want to get comfortable with the fact that we're having to scramble to get people access to the care that should be in their communities, that should be, publicly provided, that should, all of the things Dr. Ghazaleh said. It worries me sometimes.
Yes.
Yeah, and I will defer to you guys on what you were talking about in terms of policy, especially in advocacy. I think on the practical support and abortion funding end of this, we're in need of a strategy that simultaneously does accomplish what can happen within a region, as well as has the long-term vision. So, and as long as that fits into the long-term larger vision, and I think we are in a really great moment to recognize the strengths and the challenges of how we've handled previous crises, because definitely we've been here before, right? Like we're all saying this. We've been here before. We've seen auntie networks pop up out of nowhere. We've seen hordes of people just like suddenly providing support. That's wonderful, but we need that support to be long-term. And so the question is, how do the organizations that need to fund procedures and that need to help people cross state lines or just cross a state, which in Texas is like crossing multiple states. How do we do that right now and build together? Because we don't have enough resources to simply have that be like an independent effort. And right now, I think the expertise that exists in different spaces and like within a region can really lend itself to a specific state actually getting through a crisis like this one. But having that not just be a Band-Aid, having that be something that actually works towards a larger vision and emphasizes what, you all were bringing up earlier, which is so beautiful, which is that this is not just Texas's problem. This is the whole country's problem. We need to be tackling this as a country. So yeah, those are just my 2 cents.
Yeah. And I think like exactly to what you were saying before, Odile, like we need these networks, regional networks, because of like, we deal with disasters all the time. Like we need to move people all the time. We have a tornado in Dallas and 3 clinics can't operate, right? We need to be able to move people in the state and take care of them, but that's true of all healthcare, right? And we are so outside of the healthcare infrastructure that we've had to create all these new systems, right? But like, why aren't we in, like, we need to be working towards those solutions too, so that we're not always working in crisis management, but like building the future that we actually want.
I think I love all of this, and these points are so important. And I think Aimee's point on resiliency too really drove home something for me that I hadn't quite thought of in this way, in that by being resilient, by making things work, by being strong and delivering on the promise of making sure patients have care, that in some ways that has, been difficult for us in movement spaces to actually respond, because we are just doing the task at hand, which is important. But this larger conversation of, we can't just be in crisis management. There has to be something else going on. I'm in Colorado here, for example, and I know that our providers have experienced something along the lines of a 500% increase in demands on their time and their resources. And so what does that look like as patients are having to travel to care? What does it mean for Coloradans? What does it mean for Texans? What does it mean for providers? What does it mean for folks in the supply chain? Like, we don't like to talk about the fact that healthcare just is a business that exists in the world, along with all other businesses that rely on syringes showing up on time and people being able to punch in and punch out on the clock. So these are disruptions that are happening because of this law in Texas, that are happening in my state, that are happening in Kansas, that are happening in Oklahoma, that are happening in Louisiana. Patients are now being seen in Alabama. How far are the ripple effects is, I guess, my question. And what does it mean for folks like, residents of Colorado? What does it mean now? And is there a way that we can activate folks in ways that actually push back, so that we can, center the local folks, but have folks who are impacted nationally to come in and help? What can we do? Because I know folks are basically like, help.
I mean, I think we listen to the people on the ground doing the work. I mean, as you said at the beginning, like the Texans have been sounding the alarm, not only since the beginning of our first legislative session back in January, when this bill was first introduced, but after 2013, when half the clinics closed. And, like as the 28 other restrictions that are in place in Texas became implemented, we've been sounding the alarm. And it's hard for other people to listen, especially in their states, when they're also combating these same things. But I do think that it's important to listen to the state advocates and have a multi-state and regional strategy, like what Odile was saying. Like, it is a both situation. But I think when we're doing the multi-state strategy, we have to have a goal in mind, not to mitigate the damage, but to reverse all of the damage and start from like, abortion is a necessity that needs to be a part of our community, and it needs to be accessible to everyone. And I think we've spent so long on the defense, and that just became the norm, that we lost sight of that. And I think that this is such an exciting time. We've got so many new members, so many people investing in our organizations on the ground. And I want them to continue investing like a year and a half from now, when the news isn't really covering SB8, right? And we're dealing with the elections or whatever the case may be. So there needs to be like a personal investment from everyone to pay attention to that. And it's hard because like we live in kind of a, 2016 to 2020 created dumpster fire right now. So like we're in the middle of a pandemic. It's hard.
Yeah.
But I don't know. Sorry.
No, it's hard. And Dr. Moayedi, can you speak to just some of the practicalities on the dominoes falling with care now? I know that you are traveling outstate to provide care. That's bonkers. Like, I mean, I've traveled to cover cases as a journalist. That is not the same thing as saying, I'm a Texas OB-GYN, and to do my job, I need to go to Oklahoma.
Right. Yeah. It's bonkers, right? But everything about being an abortion provider in Texas is bonkers, right? I should, as a board certified OB-GYN, just be able to hang out my shingle, tell people to come to my office that want to, and provide them evidence-based care in a compassionate way, right? That's what I would do otherwise. But I have been, I started my own practice a year ago and have been looking for almost a year to be able to lease a clinic building, because there are so many barriers, and every abortion provider in the state knows this. There are so many barriers to even being able to lease a space, and you get to 10 steps down the lease negotiation or at the first step, and they're like, oh, you're going to do abortions? Never mind, right? I can't just go to the hospital where I have privileges and ask for a clinic associated with the hospital like I could do for all my other OB-GYN work. And so for me, I see really the long game of restrictions like this, and how if we continue to only crisis respond, how they're actually going to decimate any future possibility of care in this state. If we're only focusing on this moment, right? The long game is that we're going to lose physicians. They're going to go to other states, right? How many years can all of us continue to not work? The clinics have closed down and haven't reopened. How many more will close down and not reopen? How are physicians in the state going to get training? Like, the ability to reopen, the longer this goes, becomes smaller and smaller. And so our crisis response can't just be, let's overturn this law. It actually has to really address much longer term.
And that is a perfect segue into what I have as sort of my final question, and want to open up for the questions that are piling up from the folks who are joining us, which is, the hurdles to just opening clinics is a whole different event that I definitely want us to be able to dive into, because I know folks have no sense of just the administrative headaches that it takes to become an abortion provider, let alone do your dang job. But I want to talk about, and this is kind of a grim question, so let me apologize out of the gates for that. But I do want to hear what concerns or what worries each of you the most with the longer this law stays on effect. You, Dr. Moayedi, you mentioned the long game here of closing clinics, and I'd be curious for the other panelists' thoughts on this. One of my thinking behind this is that absolutely one of the political strategies in keeping this law on the books is, like we saw with the TRAP laws, as Aimee mentioned in 2013, a strategy to close clinics because it is so hard to reopen once you're closed. So is part of the gaming of the courts here from the anti-choice movement just about running out the clock and trying to close as many clinics as they can because they know it's too damn hard to open another one? Is that what's going on here, guys? Everybody's shaking their head. Is that a yes? Did I nail it?
Yeah, I mean, absolutely. They even admitted like they didn't really want to pursue any lawsuits after SB 8 went into effect. They just wanted to like halt all like access to abortion. And they successfully did that for weeks, you know, like I think they were just trying to stop it, whatever means possible. And they know our court system is not going to save us anymore. And they know that, you know, the legal maneuvering that Jonathan Mitchell did in this bill is like so out of the box thinking that it's going to kind of, you know, befuddle people for a while until we figure out how to address it. So yeah, absolutely. I think that's one of their many tactics.
Anybody else have anything they want to add to that? If not, I'm going to jump into some questions because we've got some good ones. Okay, so one that I know a lot of people have asked, and I am really interested in everybody's thoughts here. So do you panelists believe that if there was a broad corporate response in opposition to this ban or any of the abortion bans, truly, it might move the needle? I mean, basically, who does the Texas legislature and governor respond to here? You know, we see whenever these bills come up, there's, you know, we should boycott or corporate, you know, and there's been some more nuanced responses, I think, around Texas this time. But what moves the needle? What can we do? What can folks do? Who's Abbott listening to?
Who do you think he's listening to, Aimee?
I think he's listening to the people that support his primary opponents who are like way to the right and he's trying to appeal to them. And they're a very small minority, but they're a minority that are able to garner support around election time. They're able to help suppress voters around the state. They give money to all the right places so that, you know, anybody that's in contrast to what they believe in is not able to vote easily. And I think that's it, because I think the corporate response, like, I'm glad corporations are saying something because they never have before. They did in 2019, but they haven't really been vocal. I think boycotting Texas is a bad idea because it just harms people that are, you know, more marginalized, and it's a problem. I want corporations to speak up. I don't think that's the answer, because if Abbott really cared about what corporations thought, like, he would be doing none of what he's doing right now. Like the anti-mask mandate, the anti-vaccines, like all of this does not make any sense. He just, you know, released an executive order that won't allow anybody to have a vaccine mandate. And he's all about businesses deciding for themselves. So no, I don't think that's going to influence him. I have no idea. But I think that it's whatever appeals to the people even more extreme than him is what he's going for.
Dr. Moayedi?
No, just I agree. I think it is good for corporations to be speaking up, and we need them to be, because really this is about normalizing abortion in our culture and destigmatizing abortion. But do I think that the Texas GOP cares what a company outside of Texas thinks? Absolutely not. Never have, never will. Like,
are there ways to engage business leaders in Texas to say, hey, man, this is affecting your employees? That was one of the things that I appreciated in some of the more recent statements with some of the corporate leaders who were saying, you know, this is not just about trying to be reactionary. This is about the fact that we have employees who need access to care and they may not be able to get it. And we need to you know, really explore how to do right by our employees. Do any of you see that as having traction or working in Texas, or is this just really, it's abortion and abortion is abortion in Texas, and so it's just going to be abortion in Texas?
I think if they hadn't lost so big in 2018, and then I don't know. No, I don't think it's going to make a difference. I think that literally our GOP is not the Republican Party I grew up with. There are some like way out there right contingency that is just trying to get more and more right. Because like, honestly, I think if they cared about what businesses thought, like, I think they would have done the whole COVID response differently. Like, it just doesn't make any sense to me. But I do know that the fact that like we're about to be even further gerrymandered, they've successfully passed like voter suppression type law, you know, like I just think that they don't care at this point, and they just need to get their base, who are the Trump supporters. And like, sorry to talk about elections, but they're just trying to get that base riled up. And quite frankly, I think Abbott is trying to like prove that he can get those people riled up across the country so he can run for president.
So this is once again politicians using abortion as a launching pad on the right for national ambitions is something that we should keep an eye on. All right. Well, that's terrible. Odile, you were going to jump into this conversation about corporate pressure, and I'm really curious for your thoughts on as well.
I mean, I'm going to take it in a direction that you didn't expect, but I think that what I do think corporations can do is that they can model the accessibility and legality that people should experience in abortion care by having it be named in their handbooks and saying and making sure everyone gets sick time and time off if they have to travel for an abortion, and start to name the fact that this is, again, just like so many folks have to take time off for any kind of healthcare, abortion falls into that same sphere. And so if we can name that, if we can show that that is a right that employees should have full-time and part-time, then that might start to strike a chord with folks, compel them to vote more in local elections, push their own corporations to do better by their staff who are human beings. I think that's where I'd like to see corporations do better.
I really appreciate that overlay, because it gets to, I think, Aimee's earlier point of how folks in these gerrymandered states have been so successful in getting many of these restrictions through because of the role that abortion stigma plays. So if you are an employee at a progressive company and your employee handbook doesn't say the word abortion, it might be a good time to get the word abortion into your employee handbook, because that alone is moving the needle. That may seem, kind of silly to folks, but honestly, in this day and age and in this landscape, that is a radical act to have an employee health plan say the word abortion out loud. That would be amazing. So HR panelists or HR folks everywhere, get on that. Okay, so we have a question from Galina Espinoza, our editor-in-chief, and I really love this question because it gets to all of the points that we have been talking about here, which is the effort underway in Texas to normalize SB 8 by adding exceptions in the case of rape or incest, right? Like, we're already seeing lawmakers trying to walk back the extremity a little bit and then rhetorically say, no, see, this law really isn't that bad. It's not really a ban. It's just a regulation. All of these arguments that we're going to hear, right? So these efforts to make these terrible laws somehow less terrible, what can we do, like, to reject, to just really, push back and make sure that folks who aren't dialed into this conversation, who don't wake up like we do, thinking about abortion and the courts and the conversation happening, so that if I'm talking to my Aunt Debbie in Nebraska, who is following this debate kind of tangentially and is like, well, no, but the lawmakers are adding these exceptions, it can't be that bad. Arm me with the argument that says, no, Aunt Debbie, you're wrong. Who's going to take that? Yes, I love this.
I think ultimately, we need to reject compromises from our side or their side. That ultimately, every abortion restriction is inhumane.
Yes.
That we can't compromise, even, right? We had a 20-week ban that passed as part of our omnibus bill, but that was not challenged. We were too afraid, worried, right?
I'm jumping out of my skin here, because Amani and I talk about the Texas 20-week ban all the time as the reason why other states then passed it. Because they're like,
exactly.
Look, it's not so bad. Texas didn't even challenge it.
Right. And we can't make all of these bans are inhumane. it doesn't matter if we're going to lose it or not. We already lost it, right? It's lost already.
Yeah.
And so we have to, just reject the notion that there are good abortions and there are bad abortions. We have to reject the notion that some bans are okay and some are not, and that we have to shy away from fighting them because we're afraid, right? Because if we hide our heads, they're still going to find us, right? If we just are quiet and don't make a fuss about this part or that part, they're not going to stop, right? They came for a whole right? The stopping is completely stopping. So we can't compromise either.
And they're not stopping with abortion is something that we talk about all the time at Rewire News Group. They're coming for your birth control too. They're coming for your IVF. They're coming for your marriage equality. They're coming for all of it.
All of it. Your education, right?
Yeah. I mean, there's a reason why the abortion bans are happening in the same legislative session as the voting restrictions and the anti-trans bills and the anti-critical race theory bills, right? Those are all together.
Also,
and so like
they had the opportunity. We were telling them like just how bad the bill was all through the regular session and like asked them questions during committee hearings. And they're like, oh, I didn't know that, the authors of the bill. And like, they had plenty of opportunity to amend it the first go around and they didn't like 2 sessions later because it's getting national media attention. Like they don't care about people. They're not amending it because they all of a sudden see like the way that they went wrong. Like they just don't care. And they're trying to appease whoever's out there that they care about. I don't know.
So then is one possible solution, although it sounds exhausting, constant like daylight on these lawmakers, right? I mean, the idea that bill sponsors, and we heard this in, as I've been covering legislation in Louisiana, in Ohio, in Mississippi, this is common where sponsors of these bills don't know what's in them. How, as a member of the media, can we explain that to other folks? Like, this is one of the challenges, I think, in this space is the fact that as model legislation cycles through, these sponsors have no idea what they're doing. Local media is completely overwhelmed. Many don't even have state house reporters anymore. Is part of the answer for national media to just have a spotlight always on gerrymandered state houses? Is that one of the only ways that we can push back?
I mean, I think it is. I think one of the ways that we started getting, one of the reasons why the legislators in Texas started attempting to roll back some of the harm is because there was a national spotlight on what was happening in Texas, despite the fact that we'd been trying to get that for months. Like, so I think it does help to do that. Like the media is a great tool and a great education tool to like explain to people what's going to happen. But I also just want to go back to Dr. Ghazeleh's point, which is like normalize all abortions, tell your story about abortion, like make sure that all abortions are like, there's no good abortion or bad abortion, that all abortion is healthcare and that we all need access to it. Because I think what it boils down to is we've got people that don't want to rock the boat or be unapologetic about their support of abortion, including progressives on our side. So like having to fight against these restrictions are like 10 times harder because we're still trying to bring our side along. We're trying to bring people that support abortion like along with us in our like fight. And that's just a lot of, it's hard. It's really hard to get people that are supposed to be on our side to pay attention and care and prioritize it. So I think, yes, media needs to do a good job of like highlighting it. I think also we just have to not take any compromise, like Dr. Ghazaleh said, and then be unapologetic all the time about abortion.
So there are several questions from the audience in the queue around whether or not it is, and I know that this is difficult to do for a number of reasons, but have there been any estimates on the number of patients who have missed their window of time to get an abortion in Texas since SB 8 has been in effect, or is there a sense of already of the exodus to outward states and also folks who just are continuing on with pregnancies they otherwise would have terminated. I realize we're only a month plus, a little bit into the law being in effect, but is there, from what you folks are hearing on the ground, some early indications of like true impact that you're able to share?
Probably about 85% of people that normally would have been able to get care in the state are not able to.
Holy cow. I mean, imagine if 85% of the people in Texas needed access to a heart bypass.
Right.
Couldn't get it. What does that do? What does that mean?
Well, right. What we would do then is set up field hospitals, right?
Right.
And get people to care. Right. When we treat it like actual healthcare, we approach it like we approach other healthcare.
And so that's another question that an audience member has asked is that, are there possibilities of the federal government doing something? And we've seen this come up in the conversation around Texas right now, providing care at VA hospitals, for example, or other federal properties. Is that a possibility that you are aware of? And could that be, I mean, Texas has a lot of federal land. So a lot of federal land in Texas.
Some of our coalition members have had an opportunity to talk to different members of White House committees. I don't know a lot about politics. I just pretend. And that's certainly come up, right? We can't just go to a federal park and land and start providing care, right? You need equipment, staff, but VA hospitals are already providing this kind of care for miscarriage management, right?
Yeah.
It actually wouldn't be that hard, except we have to think about that there are certain people that will not go into a military hospital to get care.
Yeah.
And it is extremely challenging. I've provided care to VA before. It's not like super simple for anyone to just roll up.
No.
And I think, I lost my train of thought with that, but yeah, I think that's certainly an option. I think it's an option, but now I remember what I was going to say. I do think though, that the Justice Department probably needs to sue itself too. Right?
I love this.
They need to sue themselves. I'm glad they're suing the state of Texas, but my read of their argument is they need to sue themselves too for not providing abortion care to the people they're supposed to provide abortion care to.
Oh, I love this. So we only have 5 minutes left. So I want to give the opportunity for one last question, and then have you all have the mic for your final thoughts, and then thank you. So do we have any information about the percentage of pregnant people who have experienced some severe health outcomes or sort of bad outcomes as a result of this law being in effect? We've talked a lot and around miscarriage management in this conversation, but I think it's really important because, as somebody who's had carried two pregnancies to term myself, every time I was in those conversations, abortion is one possible outcome of a pregnancy. So are we seeing adverse health effects already in the month to 6 weeks that SB 8 has been in effect, that we're able to share? Or are we just presuming that those are happening and we will see those later?
No, yes, they are happening right now.
That's tragic.
Let me just paint a scenario. You're 15 weeks pregnant and your water breaks. There's still heartbeat, but medically that pregnancy can't survive. There is not a way. You need fluid around the lungs to develop the lungs. And if the water breaks before 15 weeks, the pregnancy's over. That is a miscarriage too.
Yeah.
But in that scenario, the heartbeat might not stop for quite a while. And so what we're seeing in different hospitals across the state is actually hospitals setting policies that you can't intervene until the person has a fever or has started hemorrhaging or the heartbeat stops.
Close to sepsis functionally.
Right. Yes, because the way the law is being interpreted, right? That people are having to decide their own institutional risk. And even if it's not an abortion, that's not an abortion, that's managing a miscarriage.
Yeah.
That doesn't mean or protect you from a lawsuit or the fear of a lawsuit, right?
Which is the point.
which is the point. And so right now, the day this bill went into effect, it also started harming people that were pregnant, not choosing abortion. And there's no way to quantify or capture this kind of data, right? That if people don't die, actually the morbidity piece is much harder to quantify and much harder to actually link to a direct result of this bill.
What a nightmare.
That's, I mean, right? People could start pressuring hospitals in their own communities to be transparent about what their policies are around protecting pregnant people.
Yeah. And especially with the Catholic consolidation of healthcare too, that is so crucially important. Well, we have done it. We have blown through all of our time and just really like getting rolling now. I would keep y'all on for another hour if I could, and we have enough questions from the audience members that we will be answering them, I think, all week. I want to wrap up and give you folks the opportunity to just say your final thoughts and, you know, what you hope folks take away from the conversation in terms of the impact that Texas's abortion bans, not just this one, but really the fight to restrict abortion access in Texas, how it ripples across the country. And Odile, we'll start with you.
Well, I would say please donate to abortion funds and practical support organizations and volunteer organizations and doula collectives in your communities. We are going to need more resources to do more of this work and across this country. And I would also say that even if you live in a state where you think the laws are liberal, double check that. Vote still, because it may be that, like I, in New York State, live in a state that still has some restrictions. So we want to fight for laws that are free of restrictions so that anyone can access care when they need to. And if we need to be supporting our friends in another state that is facing a ban like this one, then we are able to be there to support them. So please do that and donate. And remember, I think chiefly what you may have already taken away from this panel, which is that this is not a one-time incident. We are in a constant state of crisis around abortion access. So even if it feels like Texas might calm down, it hasn't, and it won't. Stay with us, keep talking about it, keep worrying. And yeah, thank you. Thank you for this
thank you.
Our work.
Aimee?
I would just say, use the word abortion when talking about abortion, talk about it in your communities, and talk about why you support abortion care. You don't have to tell your own abortion story, but just talk about why you support it and make sure that your friends and family understand why, because I think that's important in changing the narrative.
And Dr. Moayedi?
Oh, I don't have a profound last word other than,
everything you've shared has been quite profound.
Keep, don't forget about us. This is far from over. And, I hope that everyone can really think deeply about, where their line is and how we can think boldly to move into the future rather than continuing to compromise for crumbs.
I mean, that's a pretty profound final word, I've got to say. I just want to say thank you to all of you amazing panelists for your time in this conversation. It was truly an honor to be here and to facilitate this. I want to thank everybody who was able to join us and participate. And apologies for all of the questions that you submitted that I have not gotten to yet. Please send them to events@rewirenewsgroup.com and we will answer them throughout the week. That is very important for us to make sure that you get that. If you want to learn more about today's guests and their work, we will be sending a follow-up email with links and information so that you can keep this conversation going in your own circles, in your own communities. It's so important. Say the word abortion. Ask human resources if it's in your policy. These are tactical, practical things that this panel empowered you to do in your own communities. And so that is moving the needle. And if you haven't already, please subscribe to our YouTube channel and follow us on Facebook, Instagram, and Twitter. All the Rewire News Group space. And as a reminder, we are a reader-supported nonprofit news publication. So if you can and you care about the work that we do, please head over to rewirenewsgroup.com/donate to donate any amount. That helps us put on events like this and continue these important conversations. Thank you all for your time. More importantly, thank you all for your work and your dedication to human rights in this space and for making sure that people who need healthcare get it. At Rewire News Group, we so appreciate you. Thank you, everybody who took the time to join us in this panel. Please follow up if you need it. The fight continues, and be good to each other. We'll see you on the tubes, folks. Bye-bye.